Well, welcome everybody to Vaginal Steaming in Medicine, beyond Instagram and into healthcare. So, my idea for this panel, this doctors panel, was to bring doctors on who recommend steaming, who have seen the benefits of steaming, because even though we are all on Instagram and this is how we share the information and how so many people find me. Um, the majority of people are talking about their health issues with their doctors, with their healthcare providers. So it would be really great if healthcare providers were telling people about steaming or referring them or letting them know that it's an option, right? And so the idea here is how do we get it beyond Instagram and into healthcare? And so I invited some doctors onto the panel so that we can, kind of discuss that and start to get to that place. I don't know if it is possible or if it's really just going to be something that we champion, through social media by, word of mouth, or if it is something that will be able to come into healthcare. So Dr. Nathan is a really interesting doctor. He's had a very interesting path. And so the first question I have for you, actually, I'm going to call you, is it Dr. Riley? I'm going to call you Dr. Riley during this
Yeah,
discussion.
call me Nathan.
You're so informal, but just so that nobody gets lost, so that you are a doctor. Okay. So
Totally.
Dr. Riley, tell a bit about your medical path, what your current approach to medicine is, and how did you get to this point?
Yeah, well, thanks for having me, Kelly. I feel like your audience is sort of like sort of my ideal audience, because I think people who are attracted to, pelvic steaming, vaginal steaming, yoni steaming, call it what you will, are people that realize that their bodies are not broken. And you really just need to be provided some resources in order for through salutogenesis for your body to heal itself. And we're not talking about immortality. We're just talking about functioning to the best of its ability for whatever time you have left on this green earth. And so to tell you all a little bit about me, if you haven't heard my podcast or aren't aware of who I am, I realize that I am like sort of the embodiment of everything that people don't like about the medical industrial complex. I came from a very privileged space. I had enough resources to go through years and years and years of school. Obviously, I'm a white man. I mean, I represent the whole thick of it. And that part, even in and of itself, was confronting for me. I felt like there was a lack of diversity amongst medical trainees. I felt like there was a lack of open-heartedness, open-mindedness about what the role of healthcare really is. And, I was even, I struggle even with the question as to why would a white dude choose to go into obstetrics and gynecology? And the reason that I did is because I got to see a birth. And most people, until they have a baby, especially your male, the male partner, if there is a male in that relationship, has never ever seen a birth, because it's so taboo. It's so like, it's just too gross to talk about, right? That's how we're all kind of conditioned from an early age. And when I saw a birth in medical school, I was like, oh my Lord, there is never going to be an answer as to how to do this right. That is the most captivating sort of mystical thing that you could possibly imagine. And, if you consider, let's say, I don't know, cardiology or something, you're sort of expected to always have the right answer. But with birth, it was like, there's never going to be a right answer. I'm never even going to get to go through this process. So I'm never going to have the answers. This is going to be an entire career of being able to ask questions and be curious about the nature of this experience. But of course, as I'm sure you're guessing, as soon as I got into the medical training and you get more and more focused on one thing, you start to be conditioned to think, oh, we can control this process. Everything has an answer. Even birth, the more mechanisms of control that we implement, the better outcomes we're going to get. And as everybody out there knows, especially if you're here listening to this recording, as we are confronted by higher mortality and morbidity rates for moms and for neonates in the United States, we keep throwing more medicine at the problem, and we're not getting better outcomes. If anything, we're actually getting worse outcomes. And so as we consider what is in the toolkit of an allopathic physician, which is another fancy word for a Western medicine doctor, we consider there are two big categories of things that we use. We use surgery quite a bit. Remember, an OB-GYN does 70% of their training in surgery. And then we do a lot of pharmaceutical training. So those two tools are the only things that we bring to the plate. as a result of using those tools, we actually start creating more problems than we're fixing. It's sort of like the Hydra. You cut off one head and two heads pop up. So from the standpoint of how I ended up finding Kelly's work, and Kelly, I've been following your work for far longer than you realize. It was somebody had flippantly said something about yoni steaming, and I was like, first off, what's a yoni? Second off, what are we steaming it for? And so I started going into that. That was probably about 10 years ago. And I was realizing that, oh my gosh, there are modalities out there that I never learned how to do, despite being $500,000 in debt from medical school. And despite being really, really good at this thing that I do, I didn't even learn about these other tools. So as you started exploring that, I started realizing, oh, wow, I could do these things. I could provide these opportunities for the women who are seeking care for me, for everything from pelvic pain to fertility to abnormal bleeding patterns, et cetera. I mean, the list goes on, as you know, Kelly. And I'm not creating other problems. I'm actually just providing a little support for this client. I never call them patients, because if you're patient, it means you're sick. Most people are not sick. You're just coming for a little bit of extra support. So if I can provide you with a gentle nudge in this direction through something like yoni steaming, perhaps your body can get on track on its own without me creating other problems for you that were never, elucidated from the very beginning, and that now we have to deal with later on. So the classic example is, you've got abnormal periods. You had normal periods from age 15 to 25, and now suddenly they're off. Hey, I got something for you. It's called a birth control pill. You take it every day. There's a week you don't take it, you have a bleed. It's just like having a period. And I started questioning that in residency, and I was like, guys, these are like synthetic endocrine disruptors. Let's call them what they are. They are wrenches in the gears of this very delicate orchestration of all of these feedback loops across your endocrine system. So not only have I not explored what was causing the abnormal periods, I've given you something that's toxic to your body. It messes up your endocrine system in a variety of ways. It messes up your gut. It messes up your immune system. It does all these other things, all for the purpose of, quote, fixing your period, but really not fixing anything. So if we as doctors are being honest with ourselves, we should be open to the idea that, hey, we have these tools, but we should only be using these tools when absolutely critically necessary. In the meantime, diet, movement, hydration, breathing, mindset, sleep, and all these other gentle, modalities are actually, I think, where it's at. And a lot of people have come to me because I am less likely to use that toolkit of pharmaceuticals, birth control, surgery, and more likely to say, hey, go and see my steaming professionalist, and I never see them again. And I'm like, okay, so we fixed your problem for far less money. You didn't even have to take these toxic chemicals, and I can open my clinic time for more clients. So that's where I'm at, and that's why I love this practice.
Wow. Okay. So cool. And you said so many interesting things. Yeah, I mean, that's what I tell people, after kind of, I had to, go back, because so many people were coming to me for steaming, and I was like, and with all these problems, and mind you, I didn't start steaming because I had any major issues. I had a missing period, right?
Yeah.
So it's just like, what? You've got endometriosis, and you're in bed for 5 days every month, and all these major issues. I'm like,
Yeah.
what? I'm like, and your doctor, and so it was so interesting for me to hear what people's doctors were recommending.
Yeah.
So
Yeah.
it was hysterectomy. And I remember one time we were sitting, and I was sitting in a meeting, full of women. There was about 30 of us, and somebody shared. She said, my doctor said that I should have a hysterectomy. And she said, because I've already had a child, they asked, well, are you finished having children? Then why don't you just go ahead and have a hysterectomy?
Right.
And she's dealing with period cramping and an ovarian cyst. So not even anything like too major. Like for me, those are actually real minor, type issues.
Sure.
And, she was like 34, and he's like, yeah, then you have like nothing else to worry about. Let's just take it out. And so it was like, first of all, kind of like a shocking, it was like a shocking story and experience she had. But what was more shocking was how many other people in the room were like, that happened to me too.
Yeah. Yeah.
And so it was really interesting. So I actually had to learn like a little bit more about gynecology, and what the approach was. And so I love that you said it, and I think part of that is just this education. Like if you go, like, to, a fried chicken restaurant, like you shouldn't order this. You should know that you're not going to get steak there, or like you
That's
learn,
right.
you know
That's
what I mean?
exactly
Like,
right. That's exactly
right.
right.
So like when you go into the gynecologist, you should know what's on the menu. You know what I mean?
Yeah.
And
Yeah.
so I educate people. There's two things there, and I call it the knife for drugs, right? There's surgery of
Right.
pharmaceuticals. That's what gynecologists are trained.
Right.
And
Right.
absolutely, there are situations where both of those things save people's lives. Okay.
Yeah, no doubt.
But if you're not in a life-saving situation, or that's not something that you're interested in, you got to know that those are the tools that professional has been trained in to be able to offer, right? So there might not be very much
Yeah.
beyond that.
Yeah.
But then there's people like you, there's doctors like you who weren't satisfied. And I think that's really interesting. And you say, if we're being honest, right? If doctors are being honest with
Yeah.
ourselves, right? And that's something that I started to get to. I started to be like, don't doctors, like I don't trust any doctor that doesn't feel like there's some problems. You know
Right.
what I mean? Like
Right.
there are some problematic things. There are more problems that can be created after hysterectomies. I've heard the case studies of
Totally.
problematic menopause and the prolapse that can happen afterwards and
Yeah.
so
Yeah.
forth, right?
Yeah.
The pain during sex, right? So now you've actually completely changed somebody's quality of life,
Yeah.
right?
Yeah.
Numerous
Yeah.
ways, right?
Yeah.
So you can't just, and yet it doesn't seem like people know about this stuff. So if anything, there is a problem with educating people about what to expect afterwards, right? Like if a doctor isn't aware of those things or isn't talking about those things, I don't trust the doctor,
Yeah.
because
Yeah.
you have to, the doctors know, they see it, right? And so now I actually really love doctors who will talk about some of the issues or some of the places where gynecology does have shortcomings and
Yeah.
where it can go further. But what did you want to talk at all about how your peers saw you? How did they feel at the hospital when you were, starting to
Yeah.
practice and felt more like you could integrate, some holistic methods or supportive methods rather than just, going to pharmaceuticals and surgery? Like, how were you perceived?
Uh, well, I have had a hard time with the education system, probably from an early age. I remember like in fourth grade, fifth grade, the teacher coming over and like flipping my desk angrily because I was talking to somebody, and what I was talking to them about was that there was an easier way to do the math problem. And I was showing them, but I was talking during class. And I was also like never getting a wrong question on the test. So they couldn't really like say this guy's a ruffian. He's like the, you don't get to be a doctor by just goofing around. Like you get 100% on every single test. It's a lot of people were like that in elementary school, but I wasn't like the kid who was just bombing tests. I was also like the best student, and I was disrupting the class because I was teaching my friend, how to do this thing, a math problem. But if you then take that and you look at like, oh, he's using that same like, oh, I think there might be a better way to do this over here, and talking to younger residents like that, I got called to the principal's office, so to speak, in residency so many times that they had me on remediation a couple of times. Like it makes it sound like I was a bad doctor, but it wasn't that I wasn't getting the right answer, is that I was going against the grain. And one thing in particular, I noticed somebody made a comment about the pill. I've gotten to be friends with Ricky Lake and Abby Epstein. They've got this great new film, The Business of Birth Control. Everybody should go and see it. I even have a discount code. I convinced them to give me one. If you guys want to go see it, Beloved 50. I don't get a commission or anything. I just want to get it into as many people's hands as possible. Go to the businessof.life and see the film. The film is not saying that birth control is bad. What the film is saying is that if we're not being honest as doctors about the risks, benefits, alternatives, then we're not actually providing information for a person to make an informed decision. And that's a very important principle of bioethics. So what I started doing and questioning was this whole idea with the birth control pill when I was in residency, which is 4 very hard years of training. I started questioning, well, they're not really having a period, right? And my attendings, who were like the supervising veteran docs, were like, of course they're having a period. They're bleeding every month. And I'm like, but it's not really a period. So, if I was in 5th grade, they would have gone and flipped my desk over. I mean, this is the same
Right.
sort of thing. I'm not wrong, but this is so confronting to the sort of paradigm of not even a paradigm. It's just the sort of modus operandi in the United States as to how we practice gynecology. So I started talking to patients like, yeah, you're going to bleed every month. It's not a real period. I started telling them that despite what my supervisors were saying. And, you know, there are people like Nicole Jardim, whose book is right up here, Fix Your Period. Like, I know you're probably aware of her. And um, she gets blasted by OBGYNs for teaching people through her social media that the period, the bleeding, the period you get when you're on birth control is not the same as your normal cyclical monthly bleed. And she's absolutely right. But the OBGYNs with all the credentials are blasting her. So I said, Nicole, I'm in your corner. Let me know how I can support you. And now we're doing a lot of work together.
Oh, good.
So the reason I bring up this story is that as I started realizing that these tools that I was being taught were actually totally fine and normal without considering the risks of doing it, forced me to consider, okay, if I'm not going to be comfortable using this tool, what other tools do I have at my disposal? And that's when I started really venturing into your space and figuring out like, okay, a person has an abnormal period, they're heavier periods or whatever. Let's not, you know, give them this toxicant that was synthesized in some lab and is posing as a way of fixing your period. Let's actually give their body the resources. And that's just one example, you know, to fix the problem, so to speak, to get back on track. And that's just one example of how disruptive it is when a doctor, any doctor at any level, starts to sort of say, well, maybe it's not the best thing. You've got this whole culture of people who probably know that you're right, but it's just too confronting to their practice staff to change everything they've been doing for 30 years.
It's so weird to me. It's so strange, you know, because like for you, it's not a big deal. You're dealing with truth. You're a smart person, right? Straight A student, you know, all through.
Yeah.
Myself as well.
Yeah,
But I'm also
I'm
like,
sure.
when you have perspective, right? Like, why not? To me, I'm like, okay, gynecology is at a start. It's got a couple tools. Like, let's move it forward. This is supposed to be, you know, the medical and science of, you know, women's wellness. Let's move it forward. There's some, you know, some missing parts, right? Like, you know, like why not? Why not move it forward, right? Like,
Yeah,
I
yeah.
just consider, like, I came to a point and I was like, okay, I think gynecology, you know, considering it's where it came from and
Yeah.
where it's right now, is just in its infancy, you
Yeah.
know. And
Yeah.
I'm comfortable with that, right? Like, we got to be able to move forward from there. Like, why not, you know? But there are just, you know, like there are I think, I don't know if it's laziness, you know, like there's just, or like authority, something, you know, something alarming or threatening, you know, with change, you know, for some reason. And I think, you know, specifically when it comes with women's health, I think a lot of it has to do with confronting just how we treat women, how women
Yeah.
have been treated in
Right.
gynecology. I heard another wonderful OBGYN. I'll tell you her name in a moment, but she was just saying, you know, that it was in residency, it was really strange to her to see how it's kind of like in every different like mode of medicine, or, you know, the different areas, is like the patient was consulted, but with gynecology it was just kind of like delivered, you know. She said, look, that has
Yeah.
to do with when gynecology, the current form that's being practiced, was developed, women were literally property of their husbands, right?
Yeah.
So doctors didn't need to consult with them, give them a list of options and see what treatment plan was, you know, was going to be best for them, because they were property, right? So it's
Yeah.
almost like, I feel like we're also just dealing with a lot of, I guess, a lot of that too, you know, a lot of
Yeah.
these, you know, like being okay with women having a voice, right? And I do think I see a lot of the change happening, um, not from people who look like you, but people who look more like me who have entered gynecology, right? But that's why I love it. Like, we need a white man to speak. We need a
That's a
white man to be
really
able to
good
speak
point.
to other white
Yeah.
men,
Mm-hmm.
right? Like,
Mm-hmm.
and say, but I see a problem with this too. Like, the black girls are right. The black doctors, you know, like,
Yeah. 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 I want to comment on something you said, because when we think about the history of gynecology, we all kind of go back to the like J. Marion Sims, where they were doing experimental surgeries without anesthesia on black slaves, you know, and this and that. And like that is a part of the history, but this goes way back. Way back. I just released an episode on my podcast. It was like 4 months worth of research. And the title of the episode is A Briefish History of Western Medicine, Witches, and Women Healers. I recommend everybody go and check that episode out, because what I do is I go all the way back to early written human history. And we see how cosmologies and power dynamics have shifted over the ages. And women and the healers of women, who were generally women themselves, were always using more gentle approaches. They were using empirical sort of evidence-based, like, this works in this way, but if we add a little bit of this, it might work a little better. Now we have this, and this knowledge and wisdom was passed down. And a lot of that knowledge would have been lost had the witch hunts gone even, been even more catastrophic than they already were. But as you approach like the 17th, 18th, 19th centuries, what you saw was a shift from just looking at the very physical, separating the soul spirit over here. Now we can dissect into the bodies. And the emergence of modern medicine, gynecology, is a part of that. The emergence of modern medicine was all about using very, very, let's just say, heavy duty approaches to fixing things. Whereas the women healers, the folk healers, the midwives were carrying these traditions of doing the more gentle practices. And the yoni steaming comes out of that. I mean, these are ancient technologies, but it wasn't a part of the curriculum as the modern medical establishment came to be. In fact, that would have been enough for you to be burned at the stake or tortured to death if you were, mixing these potions up. So there's a good reason for us to have a distrust of the system, even if the system does occasionally provide the surgery or the antibiotics to save somebody's life. I think that in general, I would love everybody to just consider that gynecology as a profession is extremely young. It's only been around for about 100 years. Before that, women were being cared for by women using much more gentle approaches. It wasn't until we monetized this with the help of a lot of philanthropic dollars from the Rockefellers and Carnegies and whatnot that made this a, quote, profession. And that was a systematic overtaking of the care of women by white men. And that is an important part of our history. And the pharmaceuticals and surgery and everything, those were the tools that were presented as, look at how fancy we've gotten. And a lot of people who could afford that were like, this sounds better than doing the thing that the poor people are doing. And now we're getting we're reversing that slightly. And so I like to see myself as not being the pioneer, but actually upholding the sort of lay healers, of antiquity, because there's a lot of stuff that is coming back and we're realizing, oh my gosh, this is so much better than a scalpel or a drug.
Yes. Oh my gosh. Yes. Okay. So, and we need a term for it. Should we call it, original women's gynecology or whatever it might be? But it was never, for example, when you look at the 6-month checkup after giving birth, this time period, this 6-week time period, you would have never seen that historically before men took over. That 6-week time period was when everybody was there. There was a lot of treatment happening during those 6 weeks, right? So this idea that, the woman delivers, gets sent home and then you see her again 6 weeks. That's not how gynecology was set up originally. That's not how women did gynecology. A male form of gynecology, right?
That's
that really is only a couple hundred years old. Like
if that. Yeah.
And what you always find, there are a couple universal things about this original women's gynecology. And you will always find vaginal steaming or
That's right. That's right. Yeah.
It's universal.
Yeah.
There are a couple other things that are universal: abdominal massage, herbal teas and soups. There's some very specific things, some abdominal wrapping. You will find these things all over the entire world. And Dr. Nathan, you'll see I go over them in one of my classes.
Oh yeah, I just signed up, so I'm going to be training with Kelly. She's now my mentor. She's now you're my attending. Please don't flip my desk over. I'm just trying to be a good boy.
I mean, it's really fascinating for me to see, steaming all over the world, and then also to see abdominal wrapping all over the world. And it looks so cool. Oh, here's African midwives doing it. Oh, here's like indigenous midwives in Latin America doing it. Here's the midwives in Hawaii doing it. Totally. Everywhere in the world, you see these same forms of treatment, but they're missing from what we currently have, like this. So I don't know, you probably have these books for everybody. If you want to know more about the history, you got to check out this book. It's making.
Oh, I don't know that one.
Making Women's Medicine Masculine: The Rise of Male Authority in Pre-Modern Gynecology
Oh
by Monica.
boy.
And so this is where, she talks about how the laws changed in
Yeah.
Europe. Before
Yeah.
that, this was the main book of gynecology in Europe, the Trotula, which was written by a female physician in Italy. Steaming
Salerno. Hmm.
recipes are all throughout this book for everything, for difficult labor, for postpartum, for infections, for, infertility issues, right? They recommend steaming all throughout it. In fact, I think they're even the picture is some men holding a woman over a steam pot, right? Like steaming was used like
Yeah.
throughout Europe, and
Yeah.
this was considered the gold standard for gynecology, and it was women's gynecology.
Yeah. Of
And then
course.
Monica explains how it changed. The laws changed. They actually made it illegal for anybody to practice medicine who did not have a doctor's degree. And at that time, only men were going to universities and getting doctor's degrees. And then you had the witch hunt. So you, like within 100 years, all of the female physicians and midwives, all of a sudden what they were practicing was illegal. And she
Yeah.
actually goes through some of the public trials they did of these women. They killed a lot of them, put a lot of them in jail just for delivering a baby or just for giving somebody herbs for an infection, right? So that's what happened to steaming. That's when it got lost, during
Yeah.
that
Yeah.
stage. That's what I figured, because there's just no, it's universal, it's everywhere, even all throughout Europe it was practiced. But then that was the switch, right? When you went from this male gynecology, you know, she calls it male authority in pre-modern gynecology. So I
Yeah.
guess, we want to talk about where returning to the female authority in, in now future gynecology, or also
Yeah.
what is past gynecology. But anyhow, so cool, so
Well,
interesting. We're nerding out, Nathan. I knew
yeah,
we would.
let me make a comment on that because you're bringing up a lot of really good points. Trotula was actually a female instructor at one of the first and most famous medical institutions in Salerno, Italy around 1000 AD. And she had a knowledge of how to do C-sections and everything else. Like this is some ancient wisdom collected at this medical institution. And one other thing I want to say is that as they started opening up medical institutions to female trainees, there was a drop in prestige because people have always devalued women in societies that are going downhill. That's why our society is struggling right now. We're not valuing the magic of women, and your magic is in your sexuality. And as long as we're not willing to talk about yonis and uteruses, and it's too, gross to show videos of birth and whatnot, or nipples for heaven's sake on Instagram, we're going to continue to slide that way. Now, what I'm not saying is that we need to start just be
Free the
nudist all
nipple.
day long. What I am saying is that it's still taboo for women to even exist and have any sort of sexual sort of inspiration. So the important facet, I think, as we've looked across history, which even is present today, is that when the prestige started dropping because women were joining the ranks, there all other sorts of things happened. But you would expect that women would want to hold on to their role in caring for women through birth and through gynecology. But what actually ended up happening was, in order to professionalize women's medicine, the female healers who were accepted to early medical schools actually started, speaking in the same way. They sort of adopted the same kind of, I would say, anti-feministic worldview of the male regular doctors, as they called them. So it's a lot of horizontal violence there as well, fighting for privilege over actual equality. And so I think we're starting to see a shift there. I also think it's important to remember that when the Protestant Catholic worldview really took its hold, we haven't really broken free of that, where we have original sin. We have women should feel pain in childbirth because that's how, you're reflecting the transgressions of Eve. I mean, there's all of this Christian theology that also makes it really hard for us to kind of break free from that and actually to recenter ourselves in a, I would say, in a more secular way of living, or maybe more sectarian, but with a cosmology where we honor female deities and androgynous deities, and not just a single male figure who's on top of and in control of Earth, but rather that our magical powers, that spirituality is present within us and within the Earth itself. That was a huge cosmological shift. So the history here is fascinating. Sorry, you got me all kind of like juiced up here. So let you
I
get back to your
know.
question.
Oh my gosh, we should. Oh, we have to do something about the history of like, because it is. I remember in high school, history teachers were always so boring. They're always like, you have to know your history, or else you're.
You're bound to repeat it.
Yeah, but like I want to say with gynecology, this is the first time where I'm like, this history is very important for me to be able to make choices going
That's right.
forward.
That's right.
But okay, so then you brought up Nicole Jardim, and I do know her. And what was really, I was talking to her recently. I was on her podcast, and she said that her book, in Europe, she had to pull the part about steaming. She does talk about steaming, just like a paragraph in her
Really?
book, and they would not publish it with it talking about vaginal steaming. Her European version of the book does not have steaming in it. And so again, it comes to what's happening right now. It's just not removed from what happened historically.
Sure.
Like
Sure.
when I say, vaginal steaming helped me heal my prolapse. I had a stage 4 prolapse postpartum. I steamed because I was just doing steaming as part of my postpartum care. Had no idea it would resolve the prolapse, right? But it did. And I do know that I didn't really understand that at the time. I was just like, oh my gosh, it feels so much better afterwards, right? The prolapse completely resolved. And then, talking to my mom friends who were dealing with prolapse, I recommended, hey, why don't you steam? And they would steam, and guess what? The prolapse would also go away.
Yeah.
So now I can make, a logical conclusion. The steaming seems to be helpful, right? Now I've seen it happen with hundreds of people, maybe thousands of people now that I've heard, oh, wow, yeah, the steaming was helpful for my postpartum prolapse as well, right?
Yeah.
But if I say this online, I get attacked like I'm one of those early nurses, like one of those early witches, like, it's just so crazy that like, it's so ingrained in us, you know what I mean? To attack a woman talking about what her own method that wasn't taught from a doctor that helped her. And people they hit me over the stick with, if somebody's having an issue, they need to go to their doctor, not do your steaming. They could burn themselves, right? And I'm just like, well, good luck at the doctor. They're gonna cut them. They cut them for that kind of thing.
Yeah. Yeah.
Like there's but it's just so interesting to me that it happens, and it was very shocking at first. Actually, I was steaming before it was in the media. And once it came into the media in 2015, when Gwyneth Paltrow talked about it, all of a sudden the media started to learn about it and just sensationalize it. They were having a lot of fun with the fact that somebody mentioned vagina, like a beautiful actress. And then that's when people started to come for us. And so many of us in this community have had this experience, have been attacked online, shamed online, called horrible things, and we're always just like, oh my gosh, like, what's going on? We're just trying to get the word out. Like, I know that there's so many other people with postpartum prolapse, and I know that this is going to help them, right? And we're just trying to get the word out and help other people, and yet we do get oppressed. Like, we're still there's a continuation of that oppression that happened.
Absolutely.
Which is, women, you are not allowed to talk about medicine. You're not allowed to talk about your body. You're not allowed to tell other women about it, or else we'll kill you.
Yeah. Yeah.
I got.
I mean, it's simple.
Like, you're not gonna like it when you get sued, from people getting burns. And I was just like, what is this? It's just so interesting to me. I'm like, what is this random person online? Why are they, like, it's like they're trying to pull onto something. They're like, well, maybe we can't kill her, but we can sue her, or maybe I'm going to shame her or scare her that we're going to sue her. It's just so random. It's so weird,
Yeah.
So
you mentioned the witch hunts. Let's conceive of just how kind of bizarre this time period was. Women having been healers for all of these years. There were 3 major crimes of witches. One was the fact that you're sexual at all. If you have any lust whatsoever, any carnal desire, that was evidence that you were probably a witch. Organizing into groups. And then, of course, magical powers affecting health, harmful or otherwise. So let me just remind everybody, there was a Bible. It wasn't a Bible, but it was a real thick book. It was called the Malleus Maleficarum. And it was basically the witch's hammer is what it translates to. And this was the book that really was kind of the guidebook for anybody out there hunting witches. This is 3 centuries where millions of women and children, 85% were women and children, were being slaughtered There were so many dead bodies that they had to like just burn them in giant ovens. I mean, like it was an insanely horrible piece of history.
Wow, wow,
And
wow.
given it was only a couple hundred years ago, we have not broken far from that. And to make this worse, when a woman was tried for being a witch, and she was a healer, she had all these potions, she had amulets, she had a bucket of herbs that with a stool and a hole over top. Like, what sort of evil conjuring is this woman doing? They would bring her in front of a court. Generally, it was a priest or a judge, and then there was another person in the room, and that other person was a self-proclaimed doctor, which was somebody who looked like me.
Okay.
And what was presented is, here's what this woman was doing. We think she was healing, which of course is, again, that was one of the three major crimes of witches. And the doctor was the person who would say, was this medicine or was this witchcraft? This is a self-proclaimed doctor.
Wow.
Who was just able to say, like, basically in the Gladiator, like, medicine, witchcraft. And of course, if it's witchcraft, you're going to get hung or burned, you know. So there is a very, very important history for us to understand. And as we see this emerging, when you get pushback, Kelly, anybody out there, when you get pushback, this is just an extension of the woman hunts, also known as the witch hunts.
Wow. And you know, my sister brought that up last Halloween. She goes, have you ever noticed like all the witches for Halloween?
Yeah.
Like right now there's this like, you see like a trunk is closed and then there's like some witch feet hanging out, you know, I was like, the witch is dead.
Yeah.
The witch is dead. The witch is dead. Right. We do still
Yeah.
have a lot of this in our culture. And it's interesting. Actually, within this community, there might be some of them, like a lot of like modern herbalists are starting to reclaim this word witch, right? And I can't do it. I can't do it. Like again, I have a disassociation with that word. And so I was telling my sister, I said, yeah, I would never call myself a witch. And she goes, although she goes, if there was a witch hunt, she's like, I don't think either one of me and you would make it out. Like, you know, I won't put in the
Kelly,
word. Like,
I'd be tied to that pile of wood as well. I mean, like,
oh yeah,
we're all, you know, anybody doing
you
anything
can wear
against that.
left somewhere.
Yeah,
You're
yeah,
like,
yeah,
left.
totally.
Like,
I actually caution people, like, remember the witch, that word witch was not a word that women of the time were like, we're witches. And they were like, they said they're witches. Like that was like calling somebody some other, you know, defamatory, derogatory word nowadays. Like, I'm not going to use any
a
of them, but
bitch.
yeah,
That's
yeah,
what
or that exactly. Yeah, I mean, we've got the N word for Black men and women. Like, they weren't. It wasn't a title that you carried with pride. It was a word that was used to label you as a consecrator and a defamer of Christian theology. Period. And a lot of things that women were just naturally doing at the time would have been considered witchcraft. So whenever people are like, I'm a witch, it's like, you don't know the history of this, like how heavy that word is. You know, we can come up with other words for it. I always caution people, like, understand the history of the witch hunts. And I think we should probably try to, I know, granted, I'm a man of privilege. I guess I can say whatever I want, but it's like, I think we need to come up with a new term. Like, I think a woman healer, a healer, a folk healer. I mean, there are so many other beautiful terms that describe exactly what the women of that time would have been calling themselves. The witch word was a construction of the ruling classes and the church and state. And I just want everybody to be aware of that. I think it's cool,
yeah.
but it's,
And you're getting, you know, we're getting comments on that because, you know, somebody's saying, yeah, I 1,000% agree,
I
you know,
hear
the
you.
claim,
I hear you.
the heaviness of claiming to be a witch, and the other people are saying, yeah, but we're reclaiming it, we're reclaiming that, or, you know, that.
Yeah.
And so, you know,
Yeah.
again, there's going to be discussion, you know, about that, and we're
Totally.
all,
I totally get that.
everybody, there's no judgment, you know, there's no
Yeah.
judgment in it. Like how my instinct is not to use the word, not to use the word with
Yeah.
myself. I feel like I got enough targets on me, like, you know, like I can't be the one to reclaim the word witch, right? Like, and then so I
Right.
see the movement, you know, among the green
Right.
witches, you
Right.
know, and I think it's cute, you know. I'm always
Yeah.
like, what's up, witches? You know, it's like the only place like you can call somebody a witch, you know. And we're all gonna make our own choices. But that's so fascinating. I learned a lot. I do not and have not gone into that history, to learn that much about
Yeah.
it. But I feel it. All I know is I feel it right now, you know.
Well,
I
yeah,
definitely feel it. And I
it
want
is
to
a
move on
feeling.
beyond this.
Yeah,
But
go ahead. Go ahead.
the one thing I did want to share, that you brought up was about the religious, the religious aspect, and how that is still, predominant, in mentality. And so, without making any comments about, religion and so forth, I do want to say that there are so many people, hundreds who have personally shared with me that they believed that their cramps were because of their sin. And that's what they were taught.
Oh my gosh. Yeah.
And so, I have a class, womb cleanse caretaker. It's about, that the period is actually a womb cleanse. And here are the things necessary in order to get womb cleanse. So it resolves a lot of issues right there, because we just stop kind of plugging it up, and we need to, stop like drinking ice water when we're on our periods, because that prevents you from getting that full cleanse, right? And it's just so sweet, like, and so anyways, the cramping and that pain happens when somebody doesn't get a full uterine cleanse, and that's what that is. The uterus is chiming in to like, okay, don't worry, we'll get this stuff out, but it has to cramp, it contracts in order to do it. And so when I explained that, it's like so interesting to hear how many people do really believe that they're cursed. They were taught that they were cursed, and that's why they have that pain. And so, it was just, it's pretty, it's still pretty prevalent. It's still a prevalent, belief. It's still something that little girls are taught, and so there's a lot. But no, so far nobody's like, you know what, this is heathen, this is heathenry, and I'm just gonna go with my cramps because that's my belief. No, everybody's just like, oh, like, thank God, like, I don't have to have cramps anymore, right? Like,
right.
That I don't have to have cramps anymore. That's in general, where people go with it. But oh my gosh, so much there. Okay, so we're history nerds. Okay, me and you, we're history nerds. Noted. We'll have to pick this up somewhere else.
Yeah. We were both cut from the same cloth used to make an old dusty book in the back of some old library somewhere, and we were holding hands, side by side in the pages. So I'm glad to hear there's another nut out there.
Oh my gosh. Okay, so let's talk about steaming. So you've personally used steaming. You were sharing with me a little bit about it. Share what you will or what you want. What is your personal experience with steaming? I know you and your wife have both had experience with steaming. So, feel free to share what you want.
Yeah, well, so I personally have started using it because I think you're the one that actually taught me that it's we can call it or maybe no, you know who it was? It was Adrienne Irizarry. She had taught me that we call it pelvic steaming now instead of yoni steaming because
we do.
And I was like, really? So we had one of those bedside commodes left over from like, somebody whose family member was using it while they were sick and bedridden. And I'll tell my wife's story after, but my own personal experience with it was first I was trying to see if maybe I could decrease my sperm count using steaming, because I didn't want to get a vasectomy because I felt energetically something wasn't right there. But I ended up ultimately getting the vasectomy because it was going to provide like 15 years of sexual liberation for me and my wife, and she has carried this burden for so many years. But if you understand my practice and the energetic approach that I take to healing, for me, it was like, ooh, I'm irreparably changing my body. And I wasn't so comfortable with that, but ultimately I decided I'm going to do it. I did it. And then instead of steaming to get my sperm count down, I actually used a blend of herbs that Adrienne prepared for me in order to heal the tissue post-vasectomy, which is probably the most minor procedure, especially compared to what every woman has been through their whole life, whether it's an IUD, a cervical biopsy, or even a basic pelvic exam with a speculum. So it was very, very minor procedure, but it does get swollen. It was very black and blue. My daughter, who's 2.5 now, we always take showers together at the end of the night while my wife is feeding the baby. And she's like, Dad, a penis hurt. She's like looking and it's like bright, it's like black and blue. And we're trying to talk her through it. But then after I would get her to bed, I would squat over a bowl of herbs and I would sit there and just allow some time for me, like just me, the pot. And I would just crouch over, stack up some books, and I would allow it to steam. And I take good care of myself, but it was like within a matter of days, the skin was healed and everything just, that increased blood flow was definitely therapeutic. So that was actually what I had done. And even my daughter, the reason I brought up my daughter there is that she was like, oh, gone, all done. And I was like, yeah, honey, it's like it healed just really, really quickly. And because she was,
baby.
Yeah, I mean, she was like, it's like, this is way too much information about me, but she's in the shower with me and it's like right in front of her face. So she's always like just staring, like, what is that thing? And sorry, everybody, I know this is TMI, but it was it was within like 72 hours after I started, the swelling was down. There was obviously improved blood flow. The whole area just felt like nourished. So I was really impressed by that because I hadn't yet recommended it to a man.
Mhm.
Um, but my wife, in both of our pregnancies, my wife is Mexican and her mom brought home a bag of herbs that was like a garbage size bag. She went to the herb guy, she said, and she said, hey, my wife, my daughter's having a baby, and he sent her home with like 20 different herbs in a big old bag, and she put it in a suitcase and shipped it back to us. So we had plenty of herbs to go around for our whole community, and my wife used steaming from about day one after we had our first baby all the way up until about 2 or 3 weeks afterwards. And the bleeding, her belly went back to normal. Her, the vagina, the perineum, everything healed very, very quickly. Very little lochia afterwards, which I was really impressed by.
Yeah.
The second time around, it was the same exact scenario. Our second baby came at home. We had a home birth. So I think energetically, she was already in a better space and kind of knew what to expect. But that was our experience personally. And since I found this steaming, I just say, Adrian, I need you to see this person. And again, I just don't see them again because all they needed was a little bit of their body and their pelvis just needed some resources in order to find its way back on track. It didn't need us to hit it with a hammer. We just needed to give some additional blood flow and some additional therapy through the herbs. And a lot of women's issues have resolved. I've had fertility patients who've been so happy with it. PCOS separate from fertility, just to regulate their cycle a little bit. I had early endometrial atypia, which vanished. Now, they probably were doing some other things, but they weren't using progestins. And I thought that was pretty remarkable. HPV, I combine HPV with a product I found called Immune Intel AHCC together. Persistent HPV is gone. So I find
Okay,
that
it
to be
was
really
gone, right?
gone. Yeah.
I don't know anybody who has HPV who is steamed that still has it.
Yeah. I think
I think it's almost like just a vanishing act. And I have people
yeah.
steam for 3 months before getting retested, but I
Yeah.
honestly, I've heard stories of people who are like, well, I steamed once and now my HPV is gone. And they weren't specifically, they
Yeah.
didn't necessarily know
Yeah.
steaming was
Yeah.
useful for HPV. So maybe they just did it once
Yeah.
and went
Yeah.
away. I
Yeah.
think it's kind of like, yeah. Anyway,
Yeah.
anyhow,
No,
sorry.
amazing. I mean, amazing. It's like, the alternative pathway there for HPV is you're going back for repeat pap tests, you're going for repeat HPV. Eventually they're going to start taking very painful bites out of the cervix. And a lot of women are like, what else can I do? Is there nothing else that I can do? I'm doing the diet and exercise and everything else. What we need to do is restore blood flow to the pelvis and support your immune system with sleep and some other, some directed supplementation or just let's just improve your diet and stress in your life, and your immune system bounces back. You get some pelvic blood flow going, and your immune system takes care of the rest. It's really not
Yeah.
rocket science. It's amazing.
I think that virus just can't handle the heat and what's the process that you guys say the when all of the heat comes to the surface of the skin. What's it called?
Oh, like calor. I mean, we call it like a flushing or increased perfusion to the skin, to the tissues.
Yeah.
Yeah.
I think that virus can't handle it, right? Um
I like to reframe it since people are listening. I don't think viruses are actually out there to get us. And I don't want to
okay.
get into the COVID thing. I actually think that the reason that you have a virus, which is information wrapped in protein, is that your body has to get some message from the outside. You get sick, and that virus can start to cause disease if your body's not able to integrate the message of that virus. So if you're smoking, if you're on immunosuppressives, if you just generally aren't very healthy, you get a paradoxical effect where as your body's trying to learn, it's actually like the computer is starting to malfunction. So I think all of these technologies actually support the immune system in integrating whatever that message is from the outside,
Okay.
as opposed to this killing metaphor that we use, which has become
Okay.
so prevalent in COVID. So I just wanted to reframe that for people.
Yeah. Okay. Well, that's fantastic. Okay. So you saw PCOS outside of, you saw endometriosis. Can you tell us more about the endometriosis case?
Yeah. So as many people probably know, endometriosis it's generally has to be diagnosed by getting a tissue, but there are certain things you can see on ultrasound and whatnot that might suggest it. More importantly, if you have a clinical history of really painful cyclical periods or not cyclical, there's probably some degree of endometriosis. So when people get that diagnosis, doctors are either going to shut down your ovaries with birth control or going to shut down your ovaries from the brain with something like Lupron, which is the puberty blocking medicines that young kids use in precocious puberty, in a lot of women who want to delay puberty because they're going through some, what's called gender dysphoria. I'm using air quotes because I think a lot of these terms are sort of up in the air right now. But you generally buy yourself a trip to the operating room when you have endometriosis. It's an independent risk factor for fertility issues. And if all the pelvic organs get stuck together, you can get GI issues, you can get a lot of musculoskeletal pain. I mean, it's becoming a really, really big problem. And I think it's driven by an autoimmune process mediated by a dysregulated immune system from the gut. So the reason I know that is if you put somebody on a strict autoimmune paleo protocol, their endometriosis drops by like 50%. They're having way less pain. Perhaps their fertility bumps up and everything else. So an incredible adjunct to that is to increase blood flow to those pelvic organs and allow, again, the immune system, give the pelvic organs in your immune system as much resources as possible. And that can come through the lens of Chinese medicine with the herb selection and increasing blood flow just from the steaming practice itself. I'm actually really curious, Kelly, to see if we took two groups of my clients and I had one use just really hot water
Yeah.
and maybe like, I don't know, green tea, doesn't really matter. And the other, a proprietary blend, I bet the steaming itself actually has profound effects without even,
100%.
Really? Okay. Yeah, that's been my gut has been telling me that. So, a lot of women, they've got like debilitating pain. And then it's almost like overnight, I don't hear from them again. I'm like, how are you feeling? They're like, I'm feeling great. We're going to try to have a baby now. And it's like, I mean, the steaming stuff is so potent. It doesn't work for everybody, but it always helps everybody to some degree. It doesn't make it go away entirely in some cases. But hey, if you're going to go to the operating room with endometriosis, over the next 2 years, there's like a 30 to 60% chance that you're going to end up back in the operating room. So
That's
why would we be doing that? Why don't we try this first? It just makes so much sense to me.
Yes, and the rates are so high. I have in that bookshelf, I have a bunch of gynecology books, and I can't
Yeah.
believe the rates of return surgery after endometriosis and fibroids. And I'm like, I'm pretty sure people don't know this. Like
Yeah. Yeah.
like within 1 year, like you may have to just come right back. So
Yeah.
Rocio Navarro is listening in, and she is a water healer. Nathan, you have to check out Rocio. She's so incredible. And she says, yes, she said that's the power of water, is what she said.
Rocio, reach out to me. I'd love to talk to you. Water is my new one of my new obsessions. So reach out to me. I'll give you my contact info for everybody.
Ooh, yes. And then there's a great interview for her in my one of my classes that you'll go through soon once you jump in there. And the Rocio, just so you know, everybody, that's their favorite, is the interview with Rocio, because she explains why it is so powerful, and just the I'm not even going to attempt to try to explain how but water is a very powerful healing element just in and of itself, because our bodies are made up majority of water. But I hear you saying again over and over again is that what you really understand how, without understand, like you're not even going into too much, you're just saying that increase in blood flow is what
Right.
I hear you saying over and over again. You're getting that increase in blood flow to the pelvic region, and that's what you're associating with what's creating that rapid heat. And I think that's I'm keying in on that, because that's, I think, what I do feel the most safe claiming outright is why do people ask, well, why does this work, or how could steam possibly help with this? I'm like, look, you're increasing circulation to the uterus. Anytime, like the whole body and every organ in the body needs circulation in order to function properly. So you got fibroids that go away on their own, and you got fibroids that don't, right? How about the ones that go away on their own? I bet if we studied it, it would have to do with the uterus has
Yeah.
its own process that it can do it,
Right.
right? So if
Right.
we increase the blood flow to the uterus just alone, not even adding any herbs, just increasing blood flow, you're creating a situation where the uterus can do its job. It can
That's
perform
right.
its function more optimally.
Right.
And so whether that's helping with endometriosis or fibroids or HPV or whatever it may be, or the hormones, like as long as you just increase circulation to the uterus, you're already doing something.
That's right.
Right.
That's right. Yeah. This is also a big reason that exercise alone helps a lot of women with endometriosis. Now, if it gets so bad that you can't exercise, now we're in a pickle, and that's where we start steaming. But the everybody thinks of exercise as weight loss. No, it is moving blood. It is moving lymph. It's also moving chi, prana, whatever your cultural tradition is. It's moving life force through your body. And when you move life force through, it's life-giving and your body can heal itself. It just needs to provide the resources to do so. And that's why getting people into a regular movement pattern is also a part of managing endometriosis or fibroids or anything else for that matter, fertility, etc.
Yeah, I really strongly believe in like lifestyle changes, like as far as like fitness. Before I ever even knew, well, I knew about steaming, but before I realized how incredible it was, I I would help to educate people about how to improve their periods through fitness and lifestyle, like diet, changes, nutrition, and so forth. And specifically, I love herbs and I love tea, and so like to me, I have like a jug of tea, like I have a tea formula, an herb formula for every like different cycle type, and like if you could get somebody to drink that tea every day and make a couple changes in their diet and do um, exercise at the right time, not during the period, but at the right
Right.
time during their cycle, then you can achieve the same results. But here's what happened with steam, Nathan. I'm calling you Dr.
Oh, I
Riley.
love you. I just am so glad we're friends. You just have I'm like, yeah, what is it? Tell me, tell me. I'm like hanging on every
People were
word.
steaming and having the same results without making those lifestyle changes, because those lifestyle changes require a lot. Like people sometimes don't know how to shop properly, like maybe they don't like tea or they don't like drinking, like,
Right.
anything. Like they don't like drinking liquid, which is why they have all these infections in the first place, right?
Yeah,
Like
right.
there's all these things. Exercise is a thing, especially when you have fatigue and, whatever, right? So like lifestyle changes are necessary in order to prevent the problems from coming back. But what was so fascinating when people started steaming was that they were able to sometimes get the same results without making the
Mm,
lifestyle changes. And mind you, I was never trying to tell people about steaming. I was like, listen, you need some hibiscus, some dandelion, throw some nettles in there. I was trying to get people to
yeah,
drink tea, like
yeah,
the
yeah.
right tea for their constitution, for their cycle type at the right times, right? And do some other things. And everybody kept on being like, yo, what's that? What's that in the back? What's that chair? What's that chair with the hole in it? Like
That thing
everybody,
over
like
there.
there was this thing about steaming and people kept on asking about it. And then I had one friend who was telling everybody I had it. And so that's what everybody wanted. And I'm like, listen, guys, you have to exercise during your ovulation time period. You have to rest during your period. Like I'm trying to, like educate people, but like steaming can get very far without doing that. And I think it's because you let the uterus you reinitiate the uterus, you give it the circulation
Yeah,
to be
yeah,
able to do what it needs to solve some of these
yeah,
immediate concerns and
yeah.
these immediate issues. That's my theory behind it. But I love to hear that that's what I hear you saying over and over again. And like like I just want to go back to like what you experienced post vasectomy, right?
Hmm.
That
Hmm.
reduction in the swelling, that's what we see when people steam postpartum. Everything's swollen afterwards, or
Yeah.
very often. Everything's really swollen. And when people steam, their vulva goes back. Like you cannot tell a baby came through there. After
Oh,
4 or 5 steam sessions, you can't tell a baby came through there. And somebody could be 4 days postpartum if they start right away. And you will not be able to visibly, visualize that this
yeah.
person just gave birth. And that's what we found when we did the 4th trimester vaginal steam study, where a midwife did visuals on people who were steaming versus people who weren't steaming. And she did visuals on the same
Oh, that's
day.
amazing. I
On
love
day
that.
4, on
Yeah.
day 8, all of our steam participants were completely healed up as far as their vulva, right? So that's even just that reduction in that swelling.
Yeah.
Again, I do believe that was just the circulation itself,
Yeah.
that did that. And but even in the case that somebody does need to do a colposcopy, right? And I love that you use just normal terms, right? It's just like if somebody does have HPV or irregular cervical cells, they're going to take a scoop out of your cervix,
Yeah.
and that's going to be painful no matter
It
what.
hurts
And
like
doctors
hell, I
really judge
imagine.
people like
Yeah.
it's very minor and this and that. That's
Pinch.
painful, okay? Like you're
I mean,
taking
the
a
thing is it's like one of those claws that you use at like almost like a claw you use at one of the
oh
games.
no.
And it takes a bite of tissue out. And I was always terrible in the clinic when I was doing it because my attending would be like, just really get on there and get it. And I'm like,
Laugh softly.
and they're like, you didn't get anything. And I was like, I think there's something there. I don't know. I just was so afraid of hurting somebody.
Yes.
But yeah, that's a painful procedure.
Right. So, okay. So, but even something like that, that's just sold as, not that painful. And then how many days and people are supposed to be right back at work or their normal routine, right? I don't,
Like
they're
next
not.
day after a biopsy, there's no like work off
I
for that.
know they
Yeah, it's
give them no
wild.
time, right? But even when you look at if somebody really does need a biopsy, or if somebody's choosing to do that, then steaming afterwards. Why not? Like this is something that I feel like doctors should integrate into.
100%.
Like
Yeah.
every OBGYN nurse should be able to do the steam for somebody
Oh yeah, right
after
after.
after after that procedure. You know what I mean? Like
Mhm.
before a medical exam, a vaginal medical exam, there should be a steam prior. The nurse should,
Yeah.
you know what I mean? Like help relax the muscle, help make it more supple,
Yeah.
especially when people have trauma and, clamp up and it's going to be painful for them. You know what I mean? So many people just
Yeah.
won't even go to the doctor because they don't want to do an exam that's going to re-traumatize them or put them into pain, right? There's so many.
Totally.
I just think that it's a tool that can be used even with the tools of medicine. I think it would be so beneficial. Like if I knew that I could go do like, I mean, I had a painful vaginal exam after a sexual assault. And so I never went back to the gynecologist, right?
Yeah.
Like,
Yeah.
like
Yeah.
what a value added it would be if OBGYN nurses all knew, were trained to be able to use steam therapy and use it at these times, even when people do need that medical care,
Yeah.
right?
Yeah.
In the Czech Republic right now, one of the doulas who went through my program started, steaming people postpartum, and she also started steaming people. Oh, we did. I train how to steam for labor preparation, and she also started steaming during active labor, which is fascinating, very interesting. And so she started to write it up, and midwives and nurses got interested, and she's actually now trained. They're doing it in the maternity wards of the hospitals now in
That
the
is
Czech
so
Republic
amazing.
and in
Yeah.
Slovakia. And what they're finding is, and they don't have a practice of sending people home when they get to the hospital too early. So somebody could be there for 2 or 3 days in early labor. Well, what they're finding is they offer them steaming as an option. They set it up, geriatric chair or whatever they might have. They offer them steaming as an option. And what they find is that the clients who steam, their labor progresses very quickly. What they're finding is they're getting them in and out of, the hospital so much faster. So now the nurses and everybody in the maternity ward is completely on board. They want their clients to steam. And what they're finding is that the labor progresses much faster. So
Yeah.
again, you're now a decreased chance of having to transfer somebody, right? You can
Yeah.
have a more safe delivery. You have that they are finding that there is less tearing. There's less birth injuries, right? People aren't tearing when they're doing that steaming. Because I mean, even we know the skin, imagine skin that hasn't been steamed versus steam that has been
Yeah.
steamed. The skin is going to be more elastic, right? What they're finding is
When are
this
they, at what point in pregnancy are they starting the steaming?
early pregnancy. No steaming should take place prior to, and I'll just, since this is a public,
Yeah.
talk,
Yeah.
I'll
Yeah.
say
Totally. Yeah.
place prior to 38 weeks. So somebody should be
Got it.
full term,
Got it.
and
That's what I
somebody
was
can actually
thinking.
start steaming for labor preparation. And that's what I recommend, just start steaming for that labor preparation, because I believe for the body naturally to go into labor, you need 3 conditions. You need to have proper circulation. You have to have relaxation, which I
Mm.
believe is what allows the cervix to open. And then you have to have moisturization. Okay,
Mm.
so you'll see a lot of times people report, oh, I had a big bowel movement, and and that might be a sign of labor, and then things progress, right?
Yeah.
To me, the bowel movement isn't actually a sign of the labor can now come. It's a sign of that the person's not so dry that it's not preventing it. So you need
Yeah.
proper moisturization. Well, steam does all 3 of those. And
Yeah.
again, these are just, my ideas, my little ideas, but my first pregnancy, I went 2 weeks overdue. I went to 42 weeks. My second pregnancy, I was like, all right, what is needed? And I figured out these 3 things, and I put together my plan for these 3 things, because what I'm noticing is that people will be stalled. You can be stalled
Yeah.
because of one of these things.
Yeah.
So, somebody's a week overdue, and they're constipated, then you give them that moisturization, that lubrication in food, and with your steam herbs. And then that would be, a lot of times you see once that factor is removed, that dryness is removed, they have that
I love that. I
moisturization.
really love that idea.
Yeah, so
Yeah.
but who knows, because people are gonna deliver anyways, so who knows if what you actually did had that result, right? Like but this is how I approach it, right? But what they're finding in the maternity wards is that, again, it's beneficial to everybody, because now you have that room, freed up. Now you can move to the next person, right?
Think about
Like,
the money
you don't have
saved. Yeah,
people
they're
stalled
shorter
for all
hospital
this time.
stays.
You have less, birth injuries. So now you don't
Yeah.
have to stitch them up afterwards, right? You have that the woman is in less pain. What they're finding is that they're more able to handle the delivery without needing, as many, different interventions as far as pain management and so forth. And so it's just really incredible. Like, the whole medical team loves it. The doctors, the nurses, everybody loves having it, because it makes their jobs easier.
Yeah.
It makes
Yeah.
their clients happier, and it makes their jobs easier in multiple different ways. And so this is where it's like, I live this life. And, Dr. Nathan, I didn't do anything to get my Instagram followers. My 40,000 Instagram followers, I'm almost at 40,000. I was requested by somebody to start an Instagram account because she told me that they were talking about pelvic steam, vaginal steaming on Instagram, and she
You're
needed
like,
to.
okay, whatever.
So I put it up, and a couple of years later, I have now 40,000 followers. And these are people who, to me, it's an indicator of the need, right? That people aren't satisfied with the options that they're being offered. And so they're looking for something else, right?
Absolutely.
That's an
Absolutely.
absolute indicator of that. I've paid no money for advertising. I've paid, I didn't
Yeah.
even know what Instagram was. I didn't even know it was fun. I like it now, everybody, but I was just like, why do I need to be on Instagram? Like, I just wasn't,
Yeah.
I hardly post. There's no selfies of the coffee that I drink every day or my matcha. There's nothing, right? And yet there's some information about steaming, and we have now this community of 40,000 people, right? And that, to me, that's an indicator of the need. And so I'm like, well, this is great that people are able to find this and get this information. But also, when they go to their doctors, they should be getting this information. Do you know what I mean? Like,
Yeah.
the majority of people who have endometriosis, fibroids, stuck in, overdue labor and all of these situations are not ever going to be able to find me or find this information and figure out how to integrate it. So it's like, I think it's time, I think there's enough of us now. I think there's doctors like you who do see the benefit, who can talk about the benefits to it. To me, it's like, it's time that we somehow have to get this into the hands of, healthcare professionals, because they're the ones that are actually interacting with the clients.
That's right.
In need, and they're the ones who have the, and so that's why I start to imagine this, like, why not
Yeah.
have a steam session after a colposcopy? Why not have a steam session before an exam? Like, we just,
Yeah.
why not have,
Yeah.
maternity nurses, trained to be able, or obstetric nurses be able to train to be able to offer that first steam session to somebody afterwards, and to accelerate that healing, and
Yeah.
that reduction in the swelling that's going to happen, right? We don't need new moms to be waddling around like this.
Yeah. Well, I mean, and there's also two things. There's a lot of money to be saved by using these low cost interventions that are also a really nice time for a person if you're suffering from any medical condition, there's always some lack of harmonization with your environment. And for many of us who are only incentivized to be productive, to do, to make, to produce, to create, to run all the businesses and raise all the kids and do all that other stuff, when do you actually just take a time to sit back and enjoy some time with you? Energetically, we really are craving that. We're really needing that. So whenever a woman or a man, from in my case, takes on a steaming practice, that's actually like 20 minutes of your day that is your time alone. And that's also something that is really, really helpful. And as a therapeutic, hey, it's a win-win. You're getting this support for your pelvic organs, you're improving your health, and you're slowing down for maybe the first time in a week. And you're just taking some time for you, sitting over a pot of herbs that only cost you pennies to the dollar compared to a lot of these other, costly things like surgery and everything else. And especially in the postpartum period, for me, it was like, I felt so honored to be able to make the herbs for my wife and for her to go and have that time while I held our new baby. And it was my time with the baby, and she had some alone time for once to just check back in with her body on an energetic level. We're far more complicated than just physical beings.
Yeah.
And that was so healing for her to be able to spend some time for once alone without having the baby on her chest. Even though she wanted the baby there, it was still time for her to just be with herself. And so it was a really great way for me as a partner, one of the few things that I could actually do to help her. And
Yeah.
so we were able to like, honor one another in that way. So like there's more than just what does the data say and all of that. It's a nice thing to be able to do something for yourself. And I found that for myself personally as well.
And you're getting mad props, Sister Vicky saying, look, I can listen to this over and over again. It does. There's something about hearing you say this that's very healing. There's a lot of Black women here today. This is not usually what we hear white men talking about, and for you to be a doctor and to be saying this, like, I definitely
Yeah.
feel that too, Sister Vicky. Like there's healing, and in hearing you say that, and it's incredible. It was reminding me, Dr. Gauri Motha is a doctor in the UK. She's from Sri Lanka, and she says that back home in Sri Lanka, people in the household will do the steaming. They'll set up the steaming, and so her viewpoint is every household that has um, that has a birth giver, should have that training to be able to offer those treatments, in those
Yeah.
in that
Yeah.
postpartum. How about, have you thought about that, Nathan? Dr. Riley, I asked the question, in a perfect model of care, how would you see steaming integrated?
I mean, I think you highlighted a lot of really, really great points already. You've kind of got my wheels turning that when I actually do open up a sort of healing sanctuary, having a clinical exam start with, somebody mentioned this in the comments, having it start with like, hey, let's just do 20 minutes of steaming. Let's relax the pelvic floor. Let's relax the person. There's a person here. It's not a woman in stirrups with a drape over it. Like there's a human being here who has created life, who is the creative force of the universe. I mean, you are the vessel for everything that we conceive of in the world. We need to be honoring that. And we need to be honoring it across the board. This doesn't need to be just a practice that only women who can afford a $5,000 stool, gold-plated stool, and herbs from the top of some mountaintop in the Himalayas. Like this doesn't need to be like anything more than it has to be, which is an opportunity to honor our clients, our patients, our wives, our mothers, our daughters, etc., our sisters. And so for me, I don't see it as a medical intervention. I see this as a part of life, that this is just as important as taking a shower. And I don't mean to, shower is a bad metaphor to use here, because it's not just a hygienic practice. Again, this is an opportunity for the women in our lives to connect with their inner guidance, their intuition, and to be able to sit there and just have 20 minutes to not worry about anything else. Like honor women in that way is something that we haven't, I don't know, we haven't really been creative enough. Instead, we've put all of our creative juices into demanding that women are not only the people who bring lives into the world. They're not only the people who, are the angel in the house, is what we used to call them, for years ago, like the cult of domesticity. They're just as the queen bee in the hive. The little worker bees, the little men are running around scrambling to honor her because she is keeping us alive. We don't need to demand anything more of her. We don't need her to also be the CEO and everything else to be productive in our society. We need to honor women for being the creative force that they are. And your magic is in your sexuality. So as long as we can't talk about vulvas and vaginas and whatever else, which is considered immodest, what if instead a part of our culture was yoni steaming is a thing that women do? And we as men, as the worker bees, need to put all of our resources in order to honor them in whatever way that we can. This yoni steaming practice is just like, it's a no freaking duh kind of thing. So I don't see it as like, hey, what's the indication for steaming in this? And then somebody in a white coat is like, let's do steaming for 20 minutes this day and this day and this day, and then we'll crank it up a tiny bit. Like, no, let's just make it a part of life. That's the way that I conceive of it. But I also realize that I'm a little bit out there for a lot of people in the quote system. So
Yeah. You think? Okay, listen. I love that idea. If I could go to an OBGYN appointment. And I was going to sit down and have a pelvic steam as the first thing before I ever got to see the doctor or anything. I would never miss my annual appointment.
Right, it'd be
And
like
mind
a
you,
pleasure.
I never go to my annual appointment. Okay, guys, like, and that was before I had steaming, but now I'm like, oh, thank God, because I was probably gonna die because I will never go to the gynecologist. Like, I don't like nothing there felt good to me or like I want to go back. But yeah, I would go every year. I would, what? I need to go every 6 months? Fine. You know what I mean? Like and I think it would be actually, as we think of, this male form of gynecology we currently have is going to change. It has to. People are
Yeah.
not satisfied with it, right? Um, and so as it's transitioning, I think it would be a good move for any doctor to, to have their nurse trained in this modality and do that pelvic steam before they ever even come, into the patient, or have a separate, steam spa room setup, steam room setup, because I mean, like, you think like there are things that feel good. Like, I'll give an example. When you go to the dentist, it's like the dentist is whatever, but the dental hygienist, you feel so good afterwards, right? Why not, right? Like, that's why I go because of the
Yeah.
dental hygienist, not because of the dentist, right? So it's like with, you know gynecology, if you know that you get to have that steam for your appointment,
Yeah.
people would
Yeah.
come. I mean, it would save lives, right? Because
Yeah.
you would be able to
Yeah.
detect more HPV and, like, some of the problems that do become,
Yeah.
can be,
That's
you
exactly
know,
right. Yeah. How many things are we missing because women are so tired of somebody who's relatively strange to them sticking a cold hand into their vagina without even fully consenting them on what they're doing? I mean, like, we're scaring people away, guys. We have to change this. Like, there's a reason they're having home births. It's because you'd never consent them for anything in the hospital when they're having a baby in the hospital. I love home births. Don't get me wrong. We had one ourselves. I would probably have a free birth if I was pregnant and able to have a baby. But the point being that everybody's like, how can people be so dumb to go with the dirty old midwives that don't know anything? And it's like, hold your horses, bro. Why don't we ask why? Why are they not feeling safe and seen and comfortable with you? It's because you're not doing your job as well as you could. So anyways, soapbox moment. I get really
right.
fired up about
If
that one.
hospitals really want women, especially now we know, okay, you're more in, certain populations are more in
Yeah,
danger. They go into hospital than at home, right?
absolutely.
We're losing
Absolutely.
people. Hospitals, like, if you even just think about it from a business point of view, you're losing clients every
Right.
day
You're
by
doing
not
something
taking
wrong.
them, right? So, like, if you even wanted to finesse people back, okay,
Yeah,
you arrive when you're in your labor. We
that's
have the
right.
nurse sit you down and do your pelvic steam, and take you into the room. You know what I mean? Like, why not?
Yeah, yeah,
you know?
yeah.
Yeah, it would be,
Sure.
honestly, it would be good business. Okay, I love that. Thank you so much. Okay, let's get to some of these questions. Okay, what do you see as the biggest barriers then to having steam integrated into healthcare? Clearly, you have found ways to, um, I want to say, jump the hurdles that you've seen with the current system.
Yeah,
What would you say, to, I have, let's look at a couple different levels here. What would you say to other doctors that aren't satisfied, right? Who just, maybe they don't know and haven't been able to find a way like how you
sure.
have. What would you say to doctors that, are just on the fence, but they do know that there's some problems? And what would you say to doctors that are completely like, steaming is bad, we shouldn't be doing all of these things, like, here and there, like, what,
Yeah.
like, what is your thought? What would you say in these different situations?
I think that people think that doctors have more say in what they provide, what services they're able to offer than they actually have. So people think that doctors choose to do this thing over that. It's really not. I mean, that is a part of it, yes. There are some doctors that love to just show off how good they are at doing surgery, and they're like, they have a way lower threshold to do surgery than other doctors. Um, but there is a whole bunch of cultural and economic factors that drive how hospitals and clinicians operate. So the one big one is the insurance companies. If you consider how insurance works in the United States, you pay a premium every month. You have to pay co-payments every time you go to the pharmacy or the clinic. And maybe you don't have it every time, depending on your plan, but there's a whole bunch of co-payments. Let's say you're gonna have a baby. There's tons of co-payments the whole way through. In fact, if you totaled up what it costs to have a hospital-based birth, it's still costing probably around $10,000 out of pocket for most people. Now, if you're on Medicare, Medicaid, of course, it's a little different, but my point stands. You're going to have to hit your deductible after paying taxes, premiums, co-payments. You're going to have to hit a deductible before your insurance even kicks in. So if you were to consider adding all of that up and then comparing it with what you might just pay out of pocket for something, we have this dilemma. But within the medical system, people have been conditioned to think everything I need is going to be provided through my medical insurance.
Mhm.
The issue with that is that your doctor, every single doctor and advanced care practitioner, like a nurse practitioner, signs an agreement with the insurance company. It's called a fee schedule. And the insurance company says for a visit, a 60-minute visit, as long as you hit all these check boxes, we will pay you $50. So you could spend 8 hours with them. You're hitting all those boxes. It's still $50. The same goes for any procedure, any medication, whatever else. Like there is only so much money that can be gleaned from the insurance company. And therefore, if you work at like Kaiser, which is where I did my residency training, I could talk all day about steaming. Maybe I'll buy a stool and I'll even have the herbs there. I'll get a little Bunsen burner and heat it up for you while you're waiting. I could do that personally, but that's going to come out of my pocket and I'm going to have to still fit in my normal workday because the insurance company has not agreed on that, by that fee schedule to pay me to counsel a person on exercise, diet, steaming, or whatever else is actually better than pharmaceuticals and surgery. But they do have a fee schedule for how they compensate for diagnosis and treatment with pharmaceuticals or treatment with surgery. So there is a pretty big conflict of interest there for anybody who's desiring a more natural way of healing or a truly holistic way of healing, which is why I work completely separate from. I have a private association, and then the other big factor is that your hospitals and the people running the hospital, they're setting up policies and procedures, and your colleagues who have been there for longer than you are expecting you to operate within a certain parameters. So if you're the wacky guy who has a ponytail like I do and a nose ring and rides a Harley and rides into the clinic and is like, guys, I'm going to start pelvic steaming, y'all with me? I'm not going to keep my job very long, which is why I no longer work in the system. There's those pressures to do things based on the culture of my colleagues, which has nothing to do with efficacy or safety. It's just, here's how we do things here. And I mean, that exists in every industry. It's just the way it goes. So it's not so much that doctors don't want to do it, but when a doctor learns about the power of steaming or anything else under the sun that isn't pharmaceutical or surgical, I bet that they're like, damn, that's a pretty awesome thing. Too bad insurance doesn't pay for it, or too bad my colleagues would laugh at me. So it's, there's a lot of, and then the golden handcuffs, of course, you don't want to lose your job at the big hospital system because then you lose your your big, what is it called? Pension and all that other stuff. Not to mention your healthcare benefits and all these other things that they pay for. And meanwhile, you've got $500,000 in med school debt. So the doctors aren't the only problem. It's multifactorial, just like everything else. So your question was, what's the biggest obstacle? I'd say that that's the biggest obstacle.
Yeah.
Yeah, unfortunately.
Yeah, I actually know a lot of doctors. One of my when I was in college, my roommate was in med school, and just whatever. I know a lot of doctors, and she recommends steaming. She steams herself. Another friend of mine who's a doctor, his wife, I'm closer friends with her, but I know him too, and she had the worst of everything. She had bacterial vaginosis, yeast infections, she had UTIs, bad cramps, 10-day long heavy bleeds, right? That's like, okay, wow.
Yeah.
I worked with her for 3 months. She basically all of those problems resolved. She has normal periods now, no pain, 4 days bleeding, the infections have gone away. And so
oh, I lost your audio. I can't hear your audio all of a sudden. What the heck happened?
all right, let me check this out.
I can hear you again.
Oh, okay.
Yeah,
Yeah,
sorry
so,
about that.
Yeah, it looks like my internet went out for a sec. So anyways, he loves steaming. It improved his life because it helped his wife, right? You can imagine how many other issues there are around that, right? They've got, 2, 3 kids, they got 3 kids, and
Yeah.
if she's dealing with heavy bleeding for 10 days long, like that's problematic. He also told me it's problematic when people come into the emergency room bleeding. And he says, they usually always send them away saying, well, you're having a heavy period. But it's not heavy periods. Like if it's not their period, it's not their period. And he knows this. And he says, we put them on this IV, with,
Yeah.
I think progesterone or something, he said. And he says, and it hardly ever works.
Yeah.
Like, so
Absolutely.
as a doctor, he knows that it's not working.
Yeah.
He
Yeah.
himself was just like, I can't believe steaming did this, right? But he doesn't want to talk about it because he was like first year out of med school, or
Yep.
out of his residency,
Residency. Yeah.
and didn't want to get ridiculed, you
Yeah.
know? And so it's
Mm.
like, and yet he knows, right? And so I've picked that up. I'm like, oh, the doctors aren't really, like the doctors are cool, especially I feel like young doctors,
Yeah. Yeah.
is what I've seen. Um, but yeah, it's about, I think the doctors that I have seen that now refer to steam therapists work side by side with steam therapists or have steam rooms as part of their practices. All of you guys work with your own practice. So
Yeah.
I think that's ultimately, the learning lesson here is that it's not really going to be within the system. Although in the Czech Republic, that was really unique that the maternity ward, trained everybody and that they're doing steaming, within the hospital system. So there may be different countries or places where it's a possibility. But as far as here in the USA, I do think where we see it happening is these independent doctors. So you didn't get to meet our doctors yesterday, but we have Dr. White, who is in Maryland and also opening up an office in Arlington, Virginia.
Right
She
on.
has steaming in her office. We have a doctor in
Wow.
Atlanta, Dr. Tasha Rogers, who has a steam room in her practice, right? So there, I mean, it's not impossible. And I'm always like, can you do this? And they're like, yeah, we could do this. We're doctors.
Well, I appreciate all of this, and I do think that doctors need to be aware and they need to start recommending it. But there's how many people are in this room? There's like what, 50 people here in this call, give or take. I actually kind of want to go back to what you said. You don't go to the hardware store to get donuts. You go there to buy screws and hammers. The physicians are trained to use pharmaceuticals in surgery. That's what we do.
And
We are
save
not
lives with them.
educated in diet, movement, sleep, hydration, breath, mindset, steaming, EMF mitigation. That's not our domain. We are very smart. We're very well trained, blah, blah, blah. We've invested a lot, sacrificed a lot. All that we need is for them to be recommending this out to people like you and all of your listeners so that we have as many pelvic steam specialists around that it becomes a part of the fabric of our society as opposed to a medical intervention. You know what I mean?
Yeah.
Because so in other words, anybody out there listening, there is a huge opportunity here. Do this training. Be somebody just like Adrian that a doctor can be like, hey, uh, Stephanie, can you just meet my client? And then you're like, right on. And then you send them the herbs, you get them a stool, and bam, problem is solved. It's less time for me. We don't have to change the clinic around. We don't have to do any of that. Let the hospital be the hospital, and we'll build a life raft, through the lens of pelvic steaming, so that it can just become a part of women's lives and men's lives. Matter.
And what Dr. White said is that her patients love her more because of it, right? She
Yeah,
now has more people. She has a longer waiting list because she uses steaming and acupuncture,
good for her.
modalities in her
Yeah,
private practice. And so there's a lot of times this story that, well, doctors don't want to recommend it because they don't want to lose their patients. And ultimately, if I have an obstetrician that would even let me, like I mentioned, I don't know, I get removed, I'm like you, I get removed from settings, like I did, and to get dropped by my doctor when I was 38 weeks pregnant. And my doctor didn't even introduce his name. That was my first time meeting him. He didn't know my name, and he walked into the room and he recommended that I do a second anyways, he recommended I do something I didn't want to do.
Yeah.
And didn't expect me to say anything. And I said, oh, actually, doctor, you guys haven't gotten me the results of the first, it was the diabetes test. You haven't gotten me the results of the first diabetes test. I was like, and I don't think I want to do it again because it was so sugary. And because my family has a history of diabetes, I actually stay away from sugar, And he said, well, if you don't do the tests that I recommend, then your baby can die. How can I, you be under my care? And I said, I said, so he said, so then he said, you might as well go find a different doctor. And I said, are you saying that you're going to drop me? I was like, that you're going to remove me from your care? I was like, if I don't agree to take this exam. And then he like stopped and like basically all of a sudden I realized he's talking to somebody maybe who knows their rights, and why should that matter, right?
Yeah.
He
Yeah.
didn't know he was talking to, I dress casually. I don't know. I don't walk around like I have a master's degree, but I did know that he shouldn't be telling me that my baby was going to die if I didn't do that exam. And that if he, removes me from his care as a result
Mm.
of it, that there was going to be, a problem. And so
Man.
he went, so then he kind of stormed out, left me there for a while. And, and I told him, I said, but doctor, I said, you guys didn't give me the results of the first diabetes exam. I was like, and that was like a month and a half ago. So in other words, also showing them their negligence. You know what I mean?
Yeah.
Like
Yeah.
you clearly don't need these exams for my kid. You know what I mean? Like you're not doing your job to me if
Yeah.
that's
Why are
really
you
what you.
doing the test if we're not getting results? Yeah. Yeah.
Yeah. And so anyways, I'm somebody who, like another doctor, I told them my other pregnancy, I was like, yeah, well, I'm planning on doing a home birth, but I just want to do my prenatal care with you guys. They pulled that. They were like, nope. They were like, you have to do your birth with us or else, you can't be our patient. Like I'm constantly in these, in these
Yeah.
situations,
Yeah.
But imagine if a doctor in their private practice would be okay with the fact that I'm going to steam before labor or I'm going to
Yeah.
steam postpartum. Like, I mean, we have people who are, have steam boxes that are not allowed to take them into the hospital. That happens. They're like, no, that cannot come in here, right? We have like so many situations where healthcare providers and doctors and authorities are, telling people that they can't steam, even though this person is telling them, hey, I've been trying steaming and it's beneficial, right? And so now we have to go underground and we don't have the benefit of now a doctor. And doctors are highly trained, can save lives, and there is definitely a benefit to being able to have doctors and nurses around, in these situations. And so it's like,
Yeah.
I think it's a disservice, to everybody for doctors not to learn a little bit more about this and learn how they can
Yeah.
support
Yeah.
their clients with their choices of using some medical care and also supporting their health in other ways as well,
Yeah.
right?
Yeah.
uh, we need to get, I think, to the situation where we stop kicking people out of care because they've made a different choice, right?
Start there. Yeah. Yeah.
Yeah.
Yeah. I'm with you. I couldn't have said it better myself. I think in the very, very least, physicians need to understand and be willing to acknowledge that maybe I know, and maybe this thing, which does sound a lot better than surgery or really powerful disrupting pharmaceuticals, maybe we just try this thing. If you consider sort of the culture of medical education, there are two things that I always tell people. The first is when you train as a surgeon, and like I said, 70% of your training as an OBGYN is in surgery. It's not just C-sections. That's actually one of the lesser exciting surgeries that we do. There's all these other things we do. So when you're a surgeon, ethically in the operating room, if you're not the one who's best trained and most experienced with the scalpel, think about it. Ethically, you should hand that over to somebody else, like on a community level. But when
Yeah.
you're a trainee, you got to learn. So you've got somebody watching you very carefully as you do your dissections and tie your knots and clamp your vessels and all those things. So when you're in training as a surgeon, part of embodying an OBGYN is to fake it, truly fake it until you make it. And if somebody were to ask you a question that you don't know the answer to, you come up with an answer that sounds just about right, and then you go look it up later. Even if nobody else in the room has the answer, you never say, I don't know, because that reflects incompetence. which does not foster an environment where we can actually learn more, which is why OBGYNs have been stuck in their ways for so long. If I can't say I don't know, or if I can't say I was wrong or I failed, which are the two things that are no-nos for doctors, you in order to get through it, you have to make that a part of your vernacular, that like, I always have the answer and I'm always right. Otherwise, you seem to everybody else as not being good enough for the job. And for me, like as the team leader, when I was the 4th-year chief resident, an intern would make a mistake while on my team, I would take the blame. I would say, yeah, that's my fault. And they'd be like, this guy's not, how could he possibly have made such an incompetent decision? And it's like, well, wait a second. This is
Yeah.
the team dynamic. I didn't push the button that caused the missile to go off, but I didn't educate my intern and give her adequate supervision. But everybody just wants to pass the buck, and nobody ever wants to be seen as having any blemish or never having the answer, which makes you so confined to your lane that you stop wanting to even learn or explore other options, which is why so many doctors are so late in adopting very simple techniques, pelvic steaming just being one of them.
Right, right. Thank you for that. Okay, so there's some stuff going on in the comments, and then we're going to have to start to wrap this up.
Yes.
Somebody asked, can pelvic steaming be used as a tool to buffer post-birth hemorrhaging / maternal mortality, particularly among neglected folks populations? And how does steaming impact post-birth healing? How soon is too soon? Yeah, and she shares that her sister delivered vaginally in a hospital a month ago, and then all of a sudden, started bleeding. Yeah, that's the scariest situation, and it's also, the leading cause of death still worldwide for women is that post-birth hemorrhaging. It's the leading cause of maternal mortality. So, a really important issue. I do train my practitioners to be able to work with postpartum hemorrhaging. I think that what I've found is that there is an herb used in traditional Chinese medicine or traditional Asian medicine that stops hemorrhaging immediately. It's called Yunnan Bio. It has a Chinese name. It is used by, people, by acupuncturists all over the whole entire world, and it works. I myself actually hemorrhaged after giving birth. Hemorrhaged. There was a river, coming, and it was because of retained placenta. And so I used this pill. I have a lot of acupuncture friends. I think acupuncture is incredible. And one of my acupuncturist friends was like, if I was going to give birth, I'd have Yunnan Bio on hand for in case a hemorrhage happened. She happened to mention it to me. I had it on hand doing a home birth, and I used it. And within 2 minutes, the bleeding stopped. It slowed down, to something normal. So I personally have my own, example of this case. I don't know. Oh, thank you. Thank you, Nathan. I don't know why it's not in every medicine cabinet. People hemorrhage not just postpartum, they hemorrhage during their periods. They hemorrhage when they're not on their periods. And they don't necessarily receive very competent, I feel like, response from medical professionals. A lot of times it's, well, you're on your period, and a lot of times it's, the bleeding is allowed until somebody gets to the point where they need a blood transfusion. So I don't feel like Okay, am I back, you guys?
Yes, you're back.
Okay, if I'm back. I think every household, just like, just like people keep aspirin in the cabinet for a headache, should have Yunnan Bio when there's a uterus. I think it can save lives. And we need to, I think there needs to be a public health campaign, to be able to have this on hand. It's such an incredible herb that the Chinese government keeps it a secret what the ingredients are, but they've been using it for hundreds of years. It was originally developed to use in battle in order to save warriors' lives. To stop them from bleeding to death. It's been working since then. It continues to work. Some acupuncturists use it, for women's health issues. Some don't. Some aren't trained in how to use it. So anyways, so I think for postpartum hemorrhage, that's an important thing to know. Another important thing to know is that steaming can be used in order to help release the placenta and in order to be able to help to release all of the placenta. But this is a situation where you do need training because postpartum, there's bleeding, there's lochia that's coming out. And so you need to be able to determine if it's safe to steam and if it isn't. Some people can steam immediately, and there are some steam practitioners who will steam, I've heard of 3 times within the first 24 hours in order to make sure to get that the placenta, all of the placenta has come out in order to reduce the possible risk of the hemorrhaging, right? And then I don't always think it's just the placenta that causes the hemorrhaging. I think it can be large clots and different things as well that also cause it. So again, you want to get as much out as fast as possible, but we do need people, steam therapists, highly trained in the postpartum steaming and who have anti-hemorrhaging herbs on hand anytime you are going to work with somebody in the postpartum. So I'm also not right now giving instructions for everybody to just try this on their own. You can also, if you use steaming at the wrong time, you can cause heavier bleeding. So it is important to have training there.
Kelly, can I
So
add
anyways,
something? Just because it is a public recording and because I'm
yes.
an OBGYN with like people always want for everything, I have to add in, if a person that you're attending to is hemorrhaging, like there is a river of blood coming out, do not take the extra half hour to get a steam. I have to say that because
Oh no.
if you go an extra half hour, that person may go into cardiac arrest. So this is a more of a preventative and like a mild to moderate continued bleeding. If you are truly hemorrhaging, that person needs to go to a hospital. I just have to throw that in there. Otherwise, it's a public recording. If somebody knows that I'm in the call and I didn't say something, that's gonna not look
Yes.
very good.
Thank you for clarifying that. When somebody is hemorrhaging, you actually cannot steam. It's completely contraindicated. And I think that everybody needs to have herbal medicine on hand to give that person while you're getting them to the hospital.
Yeah,
Okay, so again,
yeah.
hemorrhaging is one of those procedures we do want doctors who can save their lives to be involved. But if you can, again, so that herbal medicine should be available. So I train all of my steam therapists who work with postpartum to have herbs on hand. And that is to be able to get the person to the hospital and save their lives during that, that time period. Or while you're waiting for the doctor. I mean, people also, die from hemorrhaging in the hospital as well,
Yeah,
right?
yeah, that's right.
If there's inadequate care or if, waiting for somebody to arrive. Like, so, again, this is the number one reason for maternal mortality around the world. Everybody needs to be more involved and make sure that they have tools in order to be able to stop it. But yes, steaming is not used for hemorrhaging. It's contraindicated during hemorrhaging. Everything is, just medical care is needed there. But there's another reason why there's maternal mortality, which is eclampsia, which is basically the blood, the blood pressure goes up really high. And so what we found when we did the 4th trimester vaginal steam study was that our steam group, all of their blood pressure came down very quick. And stayed within a healthy range. And our non-steam users, their blood pressure went up. So what I'm interested to see, and without even knowing it from, even going further into studying that, is what this can do for people who have preeclampsia. Could steaming actually help to bring the blood pressure down and prevent, again, that risk of, of mortality? We don't know the answer, but what we did see was that when we were taking the blood pressure of postpartum moms steaming versus not steaming, we saw a very quick decline. And actually our non-steam users, their blood pressure actually went up by day 4 and then came back down by week 6 at 6-week mark. So, a lot of reasons why maybe their blood pressures were going up, but our steam users' blood pressure, none of them went up. All of their blood pressure came down to a healthier range. So there can be, further exploration. I hope that there will be further exploration on how steaming can be used in some of these situations to be able to help to prevent even some of the factors that lead to these dangerous maternal mortality situations. Okay, Nathan, can you tell us more about the private association? So you have learned how to work on your own now. You are doing whatever you want to do, bring all of your expertise as a doctor. You're
Yeah.
also bringing in some of these, holistic modalities that you think are going to support your clients as well. And part of what you had to do to bust out of that structure was to kind of bust out of that, I think, dependence on the insurance model. So can you tell us more about that?
Yeah, sure. So one caveat I always say, like I have my podcast, it's called the Holistic OBGYN podcast. And one thing I always say there is this is not medical advice, it's education. If you want to work with me and you want to engage me for medical advice, go to my website, belovedholistics.com, and join my private association. So people are like, what on earth is that?
Yeah.
When we consider how everything works, from the mail service to the tax agencies to our government policymakers and everything, all of that, including the insurance company and basically every corporation out there, you're living in the public. You're living in the public. And what that means is that we get benefits from being a part of the public system, the civil services, etc., Social Security and everything else. The caveat is that if you are in the public, then anything that happens is going to be moderated. Any disagreement is going to be moderated in the public, which is our attorneys, our courts, etc. The problem with being a doctor outside of the conventional medical model is that I'm just going to get rolled over at any moment if somebody gets unhappy with me. They think I've got a ton of money, they think I've got super deep pockets, and they're going to come and get me for anything that comes up under the sun. So in birth, my big platform is sovereignty and personal responsibility above all. If I give you the support and the resources to make the informed decisions that you have the right to make, there with that comes the possible downside that if something happens, goes wrong because you did stand in your sovereignty, even though you had the best information available, that's on you. Now that's not like, hey, it's not my fault. If I gave you the wrong information or if I was negligent in some way, responsible. But the bottom line is that nobody allows us to contract with one another privately. In the same way that, like, if a guy with a lawnmower is like, hey, Mr. Riley, I'll cut your grass for $20 a week, we go into a private agreement.
Mhm.
So I have done that with my entire medical practice.
Okay.
And so when people join my private association, they make a $43 annual donation, and that helps me run my
Annual?
back end. $43 annual donation in order to join the practice. It's super,
Okay.
super easy to join. And then once you're in, people send me all kinds of questions on Instagram. Like, I can't say anything until you join my private association. Now
Okay.
you've agreed to my terms of membership. You're a part of my private association. Anything we say is in the private. It has nothing to do with anybody else out there.
Okay.
So once you're in, then you get access to my menu of services, which includes one-off consultations, buying packages, or if anybody out there is in the birth work community, I have this collaborator program, which is really where I'm focusing most of my time. Instead of starting my own home birth practice, I am attending births again now, but for the most part, I have stepped back and I want to support the midwifery model of care, especially because many midwives across the country can't find collaborative physicians. And in some states, you can't do anything without a doc saying, she knows what she's doing, let her be. So I decided for a reasonable monthly fee, I will be your collaborative physician in whichever state you live in. We just, again, we sign the agreement, we shake hands, and then you call on me for everything from, can you review this operative report or this imaging? Can you order these meds, these labs? Here's my situation. What can I tell the patient? What would you do? And I'd say, well, it's unlikely that it's herpes, but here's the protocol would be to check it. If she doesn't want to get it checked, then it's reasonable to start acyclovir at this point in pregnancy, et cetera. So I help with all the clinical decision making. I can order things at the gold level. The silver level is just the back and forth. But midwives, like, I'm realizing that this is so needed that I could just do this for a living. And it's so great for me to actually be able to uphold that model in that way without
Yeah.
stepping on the toes of and competing with the midwives, by going to home births and being on call all the time. So all of that is available at my website, which is Beloved Holistics.
Dr. Riley, this is so cool. Walk me through it more. What are the different levels? Okay. And then
Yeah,
also,
sure.
midwives, or are there, or yeah, or other people who work in women's with women clients might be able to do it.
Yeah, it's everybody who's in the program works with female clients, period.
Okay.
I have very few, men alone who come to work with me. It's usually a woman and then her partner from a fertility standpoint. I have midwives, I have doulas, birth educators, I've got a Chinese medicine doctor, I've got a naturopathic doctor, I've got a couple residents who are like, I hate this. Can you help me? And I'm like, I can do my best.
Oh, yeah,
But
you have to navigate what they have to go
yeah,
through. Yeah.
exactly. I kind of am mentoring them. I'm bringing somebody on as an apprentice, and they're kind of going to be my assistant and just help. And if they want to fly and join me at a birth, whatever, that's great. That's fine too. So there are 3 levels to the program. Oh, there's also a lot of health coaches, like Czech practitioners, Paul Czech's program in Southern California. I get a lot of people coming from there. Um, so there's 3 levels. The bronze level is just $25 a month. You get access to this folder of condensed but very precise summaries of every one of ACOG's practice guidelines. So it's basically my cheat sheets for every single thing under the sun based on the standard of care per ACOG. It's a
Okay.
piece of it. It's not the entire thing. It's not like here's how to be a doctor. It's just a very good reference tool. So I've done the work. I used it to study for boards. Some residents are joining at just that $25 per month rate. They get access to it. I update it every month as the practice guidelines are updated.
No, that's
It's
really
like,
helpful because
yeah,
again, somebody might be a STEAM therapist, but when somebody comes to you and they say, "Hey, I'm dealing with, HPV," right? That might be your first
yeah,
time hearing that,
exactly,
or
exactly.
fibroids or endometriosis,
Sure.
PCOS. You want to go and you want to read something so that you have, that knowledge. That's really great, even to just have that as a reference.
Yeah, yeah. I mean, it's for me, it's like that was 1,000 hours of my work, honestly. I used to have an old podcast called the Obgyno Wino, which became Beloved Holistics Radio. And then I scratched it and I started over altogether. But every episode was a practice guideline, one of the practice bulletins. And I was using that to prepare for boards, which I took a year or 2 ago. And it lives now in this Google shared drive. And I just invite you there and you have access to all of those as long as your account is current. Um, at the silver level, that's when you get to text or email me anything under the sun, and I'll help you with the clinical decision-making process. Really, I see my role as providing education and guidance so that you, the collaborator, can go to your client and provide them with additional insight based on an allopathic doctor who hates allopathy or Western medicine as much as anybody else. Um, and so that's the silver level. That's like, I think 167 per month. And at the gold level, I will also order meds, order imaging, order labs. I will write referrals for physical therapy. It's all of those things where I'm using now my prescribing powers.
Yeah.
And I can serve any state in the United States. I'm licensed in like 12 now, but I just keep collecting them. It's like Pokemon for me, like baseball cards or something, because it's very easy for me to get licenses, and I can use I can use my prescribing authority in every state. There's a lot of midwives out there whose states, especially certified nurse midwives, whose states require them to have a doctor that reviews charts once in a while to make sure that they know what they're doing, which doesn't make much sense to me. But the CPMs and LMs and independent midwives like Marin Green, they don't need that. Sometimes they just need a doc that can write orders because in their state, licensing isn't even an option, like in New York, like in Illinois. I mean, there's a couple states that are like that. So that's the gold level. That's $297 a month. And midwives have been kind of flocking to the program. So
Yeah.
I've got about 27 spots left. If anybody's out there or knows anybody out there that would like to have an MD consultant on their team, I rarely turn people down, but as long as you have a grasp on what you're doing out there, I'm happy to be the person you can call on whenever something comes up.
Is the gold level, that's where you have a limited amount of spots, but the other two are
No, well, the bronze, I pretty much can take anybody because that's not
okay.
an actual interaction. It's 28 spots between silver and gold, however it breaks down.
Okay.
And I probably will open up more spots because what I'm realizing is the biggest barrier to women exercising their autonomy in their own care is when their midwife says something like, I think that this might be happening. I think you should go to the hospital. And once they get to the hospital or the clinic, the doctor shames them out of having a home birth. They make the midwife feel terrible. And they're given a diagnosis that some state legislator that has never had a baby or has been in a clinical setting is saying is this is safe for home birth, or this is safe for a midwife. So what happens is by going into the hospital, the doctors, without even realizing what they're doing, they give these diagnoses that actually risk the woman out of midwifery care, and now they're stuck. So instead of sending your client into the space where they don't want to be anyways, that's why they hired a midwife, just hire me And then I will be your MD consultant for everything under the sun. I have some midwives that reach out weekly, some reach out monthly, some reach out daily. It just really depends on what your needs are. But that's
That
where I'm
is
putting all of my time.
such a great solution. I think that you're going to find a lot of people in this community that are going to want
Yeah. Come on
want
my
to
way.
part of this private association. So the name of the private association is what?
Beloved Holistics PCA, Private Contract Association. But my website, somebody there, Adina, posted it there. It's all available through there. So
Wonderful. And then for those that are listening and aren't in the chat later, can you say your website one more time?
yeah, it's belovedholistics.com. That's HOLISTICS.com. And you can find everything I just described there. But of course, you can also reach out to me directly by email. It's nathan@belovedholistics.com. And I'm happy to answer any questions. Anybody who's friends with Kelly is a friend of mine now. I just adore you, Kelly. I'm so grateful that we got to know each other.
Yes, I know. Is there anything else you want to share before we sign off?
The only other thing is that my podcast has really been my baby, and I'm so excited about it. I just have loved the conversations. I'd love to have you on sometime if we can find a time that works for both of us. I think we were batting some dates around at one point, but it's really a space where we're not just saying like the clinical stuff around cervical cancer. We talk about everything from parenting to conscious conception to the spiritual transformations that are happening from maiden to queen to mother to queen to crone. I mean, there's so much that goes into the care of women. And this is really my sort of homage to the wise woman healer that we have forgotten and burned down long ago, trying to rise that back up and really putting that on a pedestal is really kind of the purpose of the show. And of course, we have the Western medicine stuff that we can incorporate into conversation. Because like you said, sometimes hemorrhage and stroke and sepsis, like these are serious medical things. But for the most part, how can we use the rest of our community's resources in order to optimize the care of women and their families? And that's really what the show is all about. So I hope everybody will go and listen to at least one episode. Give me some feedback. I have just had so much fun with the show, and I've met so many amazing people through it. And if you do like the show, it always helps to have some 5-star reviews and whatnot. It helps boost it in the iTunes ratings, which the algorithm is so dumb. It only cares about how many 5 stars you have. So I just want everybody to know that that show's out there because I'm getting great feedback and I don't plan to stop anytime soon.
Everybody, let's do that. Let's go to that iTunes of this podcast. Let's like it. Let's listen to it. Let's,
Yeah, thank you. Thank
I
you.
mean,
It only
anyhow,
takes 5 seconds, the rating thing. It sounds it's so stupid. It sounds like I'm like, please, sir, can I have some more? But it's like, it's such an easy thing and it really,
look,
really
it's
does
a
help me.
popularity contest. And if
It
we
really
want this
is.
information to be popular, then we can do, you know what I mean? Like, then we
Yeah,
need to show that we like it. I mean, that's how I see it, Like to me, Instagram is the same. It's a popularity contest.
yeah,
Like you
that's
get to
right.
be there if you're popular. So if you got if you got something to share, that's worth it. Be popular too. you
Yeah.
know?
Yeah. Well,
All right.
I
Okay, Dr.
appreciate it.
Riley, thank you so much. This is so ripe. This was so great. I can't wait to share it and for other people in the community to be able to share this. And, it's the beginning of more conversations.
Yeah, anytime anybody needs anything, please reach out. I am a totally open book. I'm just a guy with kids and a wife and a really, really blessed life in being able to do work the way that my heart is calling me to do it. So thank you for tuning in. You guys are really the magic makers out here. And Kelly, you're just a dream. So thank you. Thank you for having me. I really appreciate it.